Good afternoon. Let's try to hit a couple questions that were unanswered or seeking a little bit more detail.
Before you start, can you just say your name?
Charles Perusse.
Okay.
Thank you. I think Ben had a question about the number of employees positions being eliminated in this budget. Here are the specific numbers. There's 1,411 positions being eliminated, of which 444 of those are vacant and 967 are filled. Of the 967 that are filled, 619 will definitely be reassigned in another position in state government. Those are mostly in the prison system and other institutions where we close them but have other facilities throughout the state. Our agencies are very good at relocating employees at other institutions. That leaves 268 positions currently that are not to be reassigned and may be eliminated. But as the governor said, in the main service areas where needed, we would hope to try to find those employees jobs in other agencies of state government, but there's not a guarantee that all of those positions will find another position in state government. There was a question about the $25 million reduction in the health plan. This is very interesting in our research. As you know, the state health plan or state government provides health insurance for state employees. But when you look very closely, and the governor talked about transparency and accountability, we found through research that there's about 3% of state employees who actually don't participate in the state health plan. So they can, but they choose not to for three reasons mainly. Number one, they might be on another health plan from a prior job, either in local government or from the federal government, and or their spouse might have a better health plan than what the state government provides. So essentially what we do is we overfund the state health plan currently. That money that's being reduced, that $25 million, is part of normal year reversions. It never makes it to the state health plan to begin with, because if someone doesn't participate in the state health plan, the money doesn't go for that employee. So this is just budgeting more accurately based on the number of people who use the health plan. No services or employees are impacted with that reduction. Did we get all the questions before we start?
The Medicare rate reimbursement.
Was there a question
Josh,
about
your Medicare? Your Medicare question is what I had. No.
Medicare reimbursement rate?
Yes.
What is that at now?
Well, the way it is now is they would be frozen at their current rate. That under normal budgetary times, there's an inflationary adjustment built in for the different provider categories. What is in the governor's budget is we're proposing to freeze, to remove those inflationary rates for 2009 and to continue the freeze that was implemented in 2008, 2009. So the rate of reimbursement will stay the same. What the governor did mention is there has been some policy discussions and alternatives as we looked at how to close the budget gap. There have been some proposals on the table to reduce that base rate, that across the provider community to reduce the base rate a certain percentage. She is not proposing a reduction in the base rates for any Medicaid reimbursement cost. And the concern, as she outlined, was where the tipping point is if you do reduce rates too much, where does access become an issue, especially out in the rural counties. She did not want to do any damage to access for health care across the state, so the base rate remains the same and is not reduced.
Charlie, how were the decisions made to close those 7?
Yes, sir.
What was the basis for that?
There's several pieces of information that were important in determining what prisons to close. Number one, obviously, we looked at the ones that are costly or inefficient when you compare them to other prisons of similar custody level. Most of the prisons that were on that list were part of the old GPAC study, remember, from the early 90s, that talked about closing smaller, inefficient prisons, that their cost per day might be 20 to 40% higher than other units. So that was the main reason, is they were very costly. Number two, some of them, several of them are very costly because they're in disrepair. McCain Hospital, I don't know if many folks who have been down to McCain Hospital before, but it's in great disrepair, needs to be upfitted, and several of these prison units do. And it becomes a cost-benefit analysis. Is with it being costly, is it worth putting repair and renovation money into facilities that are 80 or 90 years old, and it's going to cost more to repair them than it is to build a new site somewhere else or to transition them to a site somewhere else? So those were the main reasons why those prisons were chosen, was because of their current repair status and because of their daily cost estimates. What's in the governor's budget is those prisoners would be transferred to existing units within the prison system. There is a no net reduction in prison beds. We're keeping the same amount of prison beds, just transferring these inmates to other units throughout the state that are, quite frankly, have been built more recently and are more efficient to operate.
The book said they would do those prisons would be double cell.
Yes.
Could you define what that means?
Yes, in some of the prisons, I believe there's going to be some double celling in Pamlico, Nash, and Warren.
Does that mean two in a cell that was made for one?
Yes, sir. Let me make sure you understand. When these prisons were built, and all those prisons have been built in the last 8 to 10 years, they're three of our more modern facilities. When they were built, there was an anticipation, the infrastructure and the size of the cell were built in anticipation that they may take on additional capacity. So where the double celling would be are in the particular areas of the prison where they have the largest cells. And so that has been something that was done actually in 2007 and 2008. The General Assembly has transitioned some prisoners in the past from these expensive units and double celled them in areas that have the infrastructure to support them.
Just to follow up on that, isn't this going to accelerate the need for more prisons and or sentencing reform or something? I mean, they've got to go somewhere that was being saved for new prisoners.
Right. I mean, obviously it's a long-term issue that we're paying close attention to. I mean, the governor and the General Assembly over the last 10 years has added several new prisons or expanded existing prisons to ensure that there's sufficient capacity based on the sentencing commission's projections for population. Obviously, that same policy discussion is going to have to go on moving forward, but this reduction recommendation doesn't impact the ability to house existing inmates at this time.
Charlie, in the summary, page 4, table 1, this education funding, I'm trying to get the numbers right in terms of when she said she's going to increase education spending by 2.5%.
Okay.
If you look at these numbers, I mean, public schools, there's a reduction from the revised budget and increases in UNC and community colleges, but the net is still a 0.6% decrease.
Right.
Are there federal dollars that are not included in the budget that are, explain what I'm missing?
Yeah, that's exactly right, Colin. It's a combination of state monies and additional federal monies that we're earmarking for education for public schools, K-12, and the community colleges. The total net change year over year from the current year and what they're able to spend versus what the budget is both for federal and state dollars next year is a $350 million increase in for all the education agencies in total. That's $118 million for public schools, or about a 1.1% increase. And then there's residual increases also in the community colleges and the university system.
Why would those federal dollars not be included in this budget, though? The $1.7 billion is included, is it not?
Yes. What you're probably looking at, Colin, and I'm not sure which table you've got, that just shows the net state appropriation. But in total budget, education is increasing by that 2.5%. And I think you have do they have the PowerPoint? Okay, there's a summary of that that shows it more eloquently that we'd be glad to provide you, that shows you the differences for each of the education agencies. Yes, got it.
Barry.
Hey, Barry.
Hey, the governor said that there were, I think, you had a table that had 20 programs that were going to either be reduced or eliminated.
Yes.
Is that in here? And do you know what the total, I guess, savings for that is?
It's actually throughout each of the books, but we are so kind as to have put together a summary sheet for you, and I think
We'll get it now.
Chrissy and David have it.
What is the total, you know the total amount?
We've got it right over here.
You know what the total amount, or is that on that sheet?
It's on that sheet, Barry. I do, but I can't remember. It's here. Thanks. It's about about 39 million the first year and 64 million in the second year, and you've got a list of coming around for you that's got the detail. But this gets at all a lot of the program eliminations, the facility closures. I mean, there's a lot of tough decisions on here.
Do you have a total figure for how much the savings is from not fully funding salaries?
We can get that for you. It's a little over $200 million, but we'll get that specific number for you.
Total savings for not fully funding salaries.
But yeah, we'll get that for you.
I know it's marked out here in pieces, but I would
Yes.
never see a total.
Hey, Mark.
I'm sorry that I didn't pick up on pieces of it. What do you do with the rainy day fund? Next year, are you using any of that?
What's in the budget before you is there's no assumption that any rainy day money will be used in 09-10 or 010-11 to help balance the budget. It's not listed anywhere in
For the health plan?
that. I'm talking about for next year. For 09-10 and 010-11, there's no assumption that any rainy day money is going to support the budget. What the governor did last week is she seized the rainy day fund, as was discussed with you all last week. But in seizing it, she has apportioned out $250 million, and it was said last week that $250 million of that will go to the state health plan this fiscal year to keep it solvent. That leaves $525 or $530 million in the rainy day fund currently, and we're using that to manage the state's business currently. Gary.
So follow up and then one more. The first question is, for non-teachers, can you give us an average of what the step increase means? I mean, what does that mean? What kind of percentage increase on average are teachers going to get?
It's an average 1.8% increase for teachers.
And then on the rainy day fund, follow up quickly. So we really don't know how much money is going to be in the rainy day fund. She hopes that she can put it all back after she deals with the cash flow issues, but you don't say anywhere in the budget how much would be in that rainy day, do you?
That's correct, and we won't know until we get through the end of this fiscal year. I mean, obviously we're managing, as the governor's eloquently said, day to day, and using that money to assist the state. And that when we close out the fiscal year, Gary will then have a better understanding of how much will be left in the rainy day.
I'm sorry, and you'd have 130 million or so from that fiscal responsibility portion that would be within that rainy day fund?
Yeah, what the governor's budget does is it doesn't spend everything. It leaves some money on the bottom line unobligated. In 09-10 at June 30th, it leaves 170. Let me get this right. About 175 million on the bottom line in the first year, and 173 million in the second year. I'm rounding up a little bit, closer to 175 than 174. And so that's 350 million over the 2 years that's unobligated, as the governor said, to use to buffer against economic uncertainties that we're facing, and also something that we may want to ask the legislature. This money that's put in this fiscal responsibility reserve for next year is we may want to use some of that money to help match federal stimulus money that comes down. There's going to be some recovery money that comes down through competitive bid processes that could be hundreds of millions of dollars, but may require a little bit of seed money from the state. So we would also want to use that money where it's a net benefit to the state.
So the question of the need-based aid for the UNC system.
Yeah.
How did y'all determine what that would be? Was that from the Board of Governors recommendation?
Yeah, that's directly from the Board of Governors. Yes, sir. Fully funds it.
So, Marion, are there pay increases for
Teachers would be funded their step, average 1.8%. No pay increase for state employees.
Scott?
I don't know that you have this in front of you, Charlie, but on page 325 of volume 2 of the state health plan, there's several figures here that show percentage growth in contract administration expenses from prior year going up 29%, 28%, 14%, 52%, 21%. There are also figures here showing total contract administration expenses per member per year going from $97.73 in 2004-05 to $179.48 in the past fiscal year. Do those figures say what? I mean, is there some explanation for those figures that is not immediately apparent?
No, and I'm not real. We'd have to get back to you on that to better understand that number. We'll get back to you.
Colin?
Charlie, could you talk about in this exercise, I mean, we're looking at these programs eliminated, just through your experience in this whole process, you talk about duplication, we're eliminating duplication. Can you give us some specific examples of, you know what, we went through this and we were doing the same thing over here that we were doing over here? Just one or two examples in that realm.
Yeah. I mean, you know, as the governor said in her remarks, in the current economic climate, one size didn't fit all. So she asked my office in working with the agencies to really do a targeted approach on what to reduce. And obviously, as you flip through these books, there's lots of line item normal efficiency reductions that you're used to seeing. But we actually focused in on programs that we thought could be eliminated because they were duplicative, costly to operate, or non-essential. And all three of those are very important. Because some might fit each of those categories. Several of the programs that are eliminated, the governor mentioned, and in our discussions, were programs that we thought were pretty good programs, that were fairly successful programs, but based on the cost per service, and given the tough economic times, and that they were not mission critical, we proposed eliminating them. And those were the kinds of tough decisions and conversations that we had as we went through it. One of them we talked greatly about was the sentencing services program in the indigent defense program in the Judicial Department, and the Support Our Students program in DJJDP. Both of those programs have been around for 10 or more years, and have do serve an area where there is a need. But when you look at the true cost of the service and the benefit that the state is getting from those services, and them not being, core to public safety specifically, and the budget hole we were trying to close was $3.4 and $3 billion. Some of those programs just were proposed to be eliminated. And as the governor followed up and said, we believe that there's some more of those that need to be vetted more fully, and through her BRAC commission with assistance from our staff, we're going to go through each of those and hope to have some more recommendations to the short session. Yeah. Hey, Mark.
You opted not to take that after all, and why was that?
There is no redirection of lottery or corporate income tax money to the public school capital fund, there's no redirection, transfer, or reduction or movement of any lottery or corporate income tax money in the budget for 09-11. The actions for 08-09 have still been taken, as was discussed a few weeks ago, except for the public school transfer. That $100 million, the governor asked that my office work with public instruction in the North Carolina County Commissioners Association to ensure that none of the existing capital projects would be stopped or hampered. And we also didn't want to disproportionately harm the poorer counties. So we're working very closely with DPI and the County Commissioners Association on that $100 million to determine how best to transfer it, but it has not been transferred yet.
Okay, so what's the safest way to say that? That you've taken the money this year, but you're not certain you're going to use it.
The money.
And the next 2 years you don't even plan to take it.
That's correct. But that $100 million for the public school capital fund has not been taken yet. It was on our list of a possible transfer, but that money has not been transferred yet because we're doing this work that I just mentioned to you. Yeah, it's still an option, but it has not been done yet.
The employees that you're considering moving or eliminating, have you told them yet that they need to get ready for this individually?
Well, there'll be obviously a lot of the reductions, have been out for the reduction options have been out for 6 to 8 weeks now, and obviously they become official, as official recommendations in the governor's budget. So, each agency will be having discussions as we move forward with those particular programs. But obviously, this is just the first inning of a 9-inning ball game. The legislature will go through their budget process over the next 4 months and may adjust or add or subtract to those eliminations. So as we get closer to an adoption of a budget, employees will will have a better idea of who's impacted.
This 1411 number, Charlie, 1,411 positions eliminated, is that through the biennium? Because it seems like it's less for the first year.
David, it's the first year. First year, no. Yes, sir.
So then what is for the second, Charlie?
I'm not sure that we have the second year number. Well, we can get it. Yes, ma'am.
From Eastern Carolina, we're kind of concerned about East Carolina University, and I noticed $4 million that will be slated for ECU Grove School of Medicine.
Yes.
So the concern is what's going to happen to the ECU Dental School. I noticed there's some cuts to that appropriation as well.
We don't have a reduction in the dental school, do we? The dental school's not reduced. There's no reduction identified for the dental school, no, ma'am.
And there was like 15,000. Was that not a reduction for 2009?
Do you have a location that you're seeing that? We can follow up.
We can follow up with you.
This gentleman.
For your efforts. The discretionary reductions tied to education.
Yes, sir.
Specifically, I know that they're recurring, and as a result of recurring, we're looking at over an extended period of time. I know stimulus dollars can be used in order to backfill. Does that mean that a discretionary reduction will be eliminated after 2 years when the stimulus funds run out?
Well, I think it's probably too early to tell. The way we have the reductions labeled currently is they would be recurring reductions of $144 million. I think that's just under 2% of the public school budget statewide. So obviously some of those can be buffered over the next 2 years with stimulus money. And quite frankly, it's hard to tell how long this stimulus money may be around. As you know, there's a lot of discussion about in Washington about investing additional money from the federal government down to to local school districts. So.
Let's just try to keep the questions to press, at least for now, so we see how much time, because he's going to be cross the street in a little while.
Jack had a question.
Charlie, some school boards are Mecklenburg and others have wondered whether the economic situation will force them at some point to lay off teachers. Under the governor's proposal, should they be reassured that there would be no teacher layoffs, or is that something that they would have to approach using whatever flexibility is built in and make district by district decisions?
Yeah, Jack, I think the governors, and I don't have the short, snappy language in front of me, but yeah, it's pretty specific that the LEA flexibility reduction, and like I said, it's not just under 2% of the budget. There's some specific language that shall do everything not to impact direct classroom instruction. So the governor has worked with Dr. Harrison, and I know Dr. Harrison's going to work with the local superintendents to ensure that this reduction is taken in areas that limits the impact on the classrooms and is what we're hoping for.
So is it fair to say it doesn't prohibit it, but provides enough so that they should be able to avoid
We would hope so.
making classrooms?
Yes.
Quick questions about the cigarette tax.
Yes.
And the alcohol taxes. I noticed on both of those that they're both expected to increase in revenues in the second budget year. Why is that?
It's just the timing. it becomes the second year is the annualized number. The first year is 3/4 of a year because it's effective September 1, but we don't start collecting the revenue till October, so it's 3/4 of a year.
Is that revenue earmarked for health care?
Not specifically, but as you see it shows as an additional revenue into the general fund. But as the governor pointed out very correctly, is that there are health care costs associated with each of these areas that's basically being subsidized by taxpayers currently. We estimate, the CDC estimates that Medicaid costs for smokers in North Carolina costs us $780 million a year. The current tobacco tax only collects $230 million. So this additional tobacco revenue would help offset existing Medicaid costs that we're already paying. Very similar in alcohol as well. We estimate that alcohol, social and direct medical costs for alcohol use and abuse cost us about $680 million a year in North Carolina, but we only collect about $250 million currently. So this additional revenue in both of these areas would help offset health care costs that we already absorb, but also, as the governor mentioned, hopefully reduces the amount of smoking and drinking that goes on, especially with our youth going forward.
Ben and then Kim.
Thank you.
And I'm not going to do this for each of these programs, but I am curious, the Labor Department's apprenticeship program, speak to the rationale for eliminating.
That actually follows along to one of Cullen's questions about what you have to go through, and there isn't a science, but there's not an exact science too, as you know, is you have to really look at these programs program by program, even programs that are good, to see if they are housed and administered in the proper place. When we looked at the apprentice program in the Department of Labor, quite frankly, when we looked at it, it didn't make sense that it was in the right place. The Department of Labor's core mission is occupation safety and health for workers, but then on the side they were running an apprenticeship program. We think, as the governor mentioned, that workforce development and those opportunities are better housed and more beneficial in the community college program. So that's why we proposed, sending it from labor to the community colleges in a restructured format that's more beneficial and less costly, more beneficial for workers but less costly to taxpayers. And that's the discussion we had in going through a lot of these programs and making the best determination we could.
Kim? Charlie, not to harp on job loss, but I just want to clarify. So your math was 268 positions currently not reassigned for 09-10.
That's correct.
Okay, I'm looking at this chart for, in your summary, I get page 8, where it's the governor's recommended general fund budget 2010-11. Am I reading it wrong? I see net position change of 1,388. Is that potential job loss into the second part of the fiscal biennium?
Yeah, but what that has, Kim, is that's a net number. It would be net increase in positions and job loss. So what we would have to get for you is to net out, because you're just focusing on the decreases, as I understand it. We'll do that same analysis for you for 010-11.
But net, when you talk about this 14-11 next fiscal year,
Yes.
there are positions created, so the actual net according to this would be 1,033 net loss. Is that an accurate number? We're trying to simplify, obviously, but I mean, if we say
It's net position change.
Okay.
That's correct, Colin. Net position change. Oh, hey, Barry.
Charlie, can I get the alcohol tax, 5% surcharge?
Yes.
How much, what is the tax now that I pay on a bottle of beer, and what will it be?
Knew you were going to ask that question.
And how much am I going to have to drown?
It's Barry, so really a 12-pack.
So he's saying you're a heavyweight drinker, I think is what he's saying.
After this budget seminar.
The way the alcohol, it's very complicated currently. We're trying to, the way it's done right now is we there's excise tax on alcohol, and I knew you were going to ask that question, so I have this little cheat sheet. Is currently the current tax is about 5 cents per can. On spirituous liquor, I'm not sure if I said that properly, is 25% of the distiller's price plus Hulk's warehouse cost. See, I told you this was complicated, Barry. Unfortified wine is 21 cents per liter, and fortified wine is 24 cents per liter. What's in the governor's budget is away from the excise tax and just to a tax surcharge on purchases at point of sale. So instead of getting into this complicated exercise of the excise tax, it would just be on a sale of each purchase. So if you go in and buy a 6-pack of beer for $6, it would be a 5% surcharge on that $6 at the point of sale. I'm not sure, and we can work on getting this for you, what that 5% is incommensurate to the existing tax structure. We'd have to get that for you. But that's what we're proposing in our budget. And Kentucky just had a 6% tax surcharge passed in their budget here recently.
Does it eliminate the current structure or replace it, or is it
No, over on top of.
So for that $6 6-pack, that's a 30-cent increase.
Correct.
So, do you apply the surcharge to the total cost as it exists right now? So, if I go in and were to buy a 6-pack for $5 total, inclusive of the current excise taxes, is the 5% on that $5 or less?
It's added to it at the end, so it would be on top.
Tax, fees and excise taxes, and then another 5%.
Yes.
And that's in addition to the 6.35% sales tax we would pay on
Yes. Yes.
On the cigarette tax, when you were figuring your projected revenues, did you take into account the possibility the legislature is going to pass this broad ban on smoking? And related to that, would the reliance on that revenue affect the governor's decision on whether to approve or disapprove of the ban on smoking?
I think I can answer the first question, but I'm not high enough on the food chain to answer the second question. I would say that we built in, and I don't want to, this is going to sound wonky, but we built in our cigarette increase costs some negative elasticity. What that means is as you increase the cigarette per pack rate, there's going to be less purchase. People are going to purchase less. So in other words, right now we may get 35 cents, $35 million for each nickel on the sales tax, or in each nickel on per pack. But when you raise it up $1, you don't get 35 million for the nickel. You only get 22 million for that nickel because of this elasticity. There's going to be negative demand. Some people are going to quit smoking. So we built that into our projections. We were very conservative on how much we anticipated that this increase was going to get for us. We assumed that some people would stop smoking, and we hope they do. So that was built into our projections. Now for the second question, that's...
We'll follow up. And we need to start wrapping up. How are we? Guys in good shape? James, you want one?
simple question? Where did you find the biggest savings? What item is elimination, action, do you think is saved the most money?
That's a good
We
question.
may have to follow up.
Give several examples, I don't know.
Well, the probably the largest reduction in the agencies was probably freezing the Medicaid and reimbursement rate for providers. That probably gets us $140 or $150 million a year. No.
One here.
I know that we have most numbers on this, but I was wondering if you go into the numbers about UNC systems, about budget cuts there, and then UNC chapter in general.
Well, I think we tried to treat all the campuses similarly. I think what you see in the governor's recommended budget is about a 5.5% or 6% reduction in appropriations for the university system. but that was built in by the truth in budgeting of 2%, and then about a 3.5% flexibility reserve where we would allow each campus to determine where their reductions can be taken. However, when you look at what we're proposing in the governor's budget in 09-10 versus 08-09, the universities across the board are net positive because of the reductions in spending for this year and that fact that we're fully funding enrollment and financial aid next year, that even with these reductions, they're net gainers about 4% or so across the UNC system. So the UNC system is being treated fairly well in this budget.
Brian,
I just wanted
and
to
then-
follow up with the flex reserve.
Yeah.
For the UNC system.
Yeah.
Could you tell me how that works?
Yeah, it's basically the legislature, as long as I've been doing this stuff, which is a few years, anytime we've made reductions, most of the time when we make substantial reduction recommendations in the university system, they have asked that they be given budget flexibility for them to identify the reductions where they see appropriate. So each campus is essentially given a number that they have to reduce, and it's at the chancellors and their discretion to where those reductions should be taken, because one size doesn't necessarily fit all for each of the campuses. So we allow them the flexibility to handle it as they deem appropriate, and it's been handled that way for the last 10 or 15 years.
Yes, Charlie, I would like to ask you about the SHIP, State Children's Health Insurance. About the enrollment includes legal immigrant children who have been living in the United States less than 5 years, because the current policy asks you to prove that your child is living here illegally 5 years.
I'm not sure if I know the answer to that question, but we can follow up with you. What's included in the governor's budget is expansion money to take on an additional 8,000 kids each year and provide them health care.